From today, up to 16 potentially life-saving treatments are being removed from the NHS Cancer Drugs Fund. Fraser Maud has more details.
Danielle Corcoran-Tanner faces an uncertain future. She knows that if her pancreatic cancer becomes more aggressive, one of the only drugs that could prolong her life is Abraxane. But it's one of a number of treatments that will no longer be paid for by the NHS's Cancer Drugs Fund.
Although it's not a cure, it gives people longer with their family, and it's hard to know that that's been taken away, and knowing that, you know, let's say it's only 2 months, but that's an extra 2 months that people have with their children, with their mums, their brothers, their sisters, and it's hard to put a price on how much that's worth.
Despite having its budget increased from £200 to £340 million a year, the fund consistently overspends. That means that a number of drugs used to treat various forms of cancer will be removed from its list. One Cancer Foundation says that could mean up to 5,500 patients potentially missing out on life-prolonging treatments. Many oncologists, like Juan Valle at the Christie in Manchester, have concerns that cancer research could also be affected.
One of the things about the UK is that we have been very much involved in clinical trials aimed at improving treatments for patients with pancreatic cancer. The next generation of trials are likely to add on to this established combination, which is now considered one of the global standards of care. The fact that in England we won't be able to do that means that effectively we're taking a step back rather than being able to build on that and move forward.
Abraxane costs around £8,000 per patient per year. From today, it won't be available for new patients in England, but will still be in Scotland and Wales. Sky News did approach NHS England to talk about Abraxane and the 15 other drugs at risk of being removed from the Cancer Drugs Fund. They said they'd rather wait until the list was finalised before they made any comment, possibly in the hope that at the 11th hour some of the manufacturers may choose to reduce the price of their products in order to prevent them being dropped from the list. Danielle says she has a modest bucket list to complete while she is still able. Her fear is that without access to a drug which she knows could prolong her life, she may not get the chance. Fraser Maud, Sky News.